I see this as a vote of confidence, but also as a responsibility to be transparent and keep working hard in promoting health, keeping the world safe and saving the vulnerable. There are quite a few challenges on our hands, to put it mildly. We have a heavy agenda ahead of us with 47 items and sub-items to be discussed, and over 20 resolutions and decisions to be adopted. Some of the items have already benefited from fruitful discussions during the Programme Budget and Administrative Committee meeting last week, under the excellent leadership of the PBAC chair, Ms. Aishat Rishnei. I'm looking forward to the report tomorrow. It will certainly make our work better focused and shorten our discussions. Other, more technical items will still need our full consideration in the next 8 days. Let me, at this point, refer to a very productive informal EB retreat in November last year, where we have discussed how to ensure that our discussions are more focused and concise, which is also in line with the Agile Member State Task Group recommendations. Some of the ideas were reflected in the guidelines sent to you earlier this month. Let me sum up for you those most important. First, we are all encouraged to be concise when taking the floor and focus on the guiding questions provided in the reports of the Secretariat. We will have these guiding questions projected on the screen during our debates. Second, I hope that many of you have posted online your written statements for all of us to be able to read them in advance and to take them into consideration for our discussions. You can still post your written statements on the WHO website, or if you have a longer statement with the information you would like to share additionally, you may send it to the email address statements@who.int. and share with us only the most important points orally. Please be reminded that written statements will not be included in the summary record of the meeting. All the introductions, anyway, are in the informal note you have received from the Secretariat in preparation for the meeting. It is my hope that these innovations will allow for a more dynamic and meaningful discussion and at the same time for sharing good practice and experience from your national context. At the retreat, we have also discussed how to best engage NGOs and civil society in the work of our governing bodies. They are crucial in identifying the needs of our populations and in particular the needs of those most vulnerable. Civil society is also important when it comes to the implementation on the ground and for ensuring that nobody is left behind. They are thus also encouraged to share their views and knowledge in a written form in advance. It is very important for us EB members to be able to take in consideration statements of non-state actors. I also want to share with you that there has been a session of the first WHO Youth Council meeting on Saturday. They are still around today and looking forward to talking to you, EB members. I believe their views can enrich our discussions. Before finishing my opening remarks, I wanted to wholeheartedly thank all of you, my fellow EB members, and the Secretariat team for all the invaluable support during my chairing so far. I truly count on you, since only together we can make a progress. I would also like to address a special welcome to 7 new members of the board. From Canada, Mr. Nicolas Palanque. From Colombia, Sir Jaime Hernan Urrego Rodriguez. From Japan, Dr. Yasuhiro Suzuki. From Malaysia, Dr. Zaliha Mustafa. From Oman, Dr. Hilal Ali Hilal Al-Sabti. From Peru, Doctoressa Rosa Guterres Palomino. From Rwanda, Dr. Sabin Nsanzimana. I cordially greet all representatives of member states, also observers, the United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. Finally, welcome to our Secretariat colleagues who are following and supporting the deliberations of this meeting, and thank you, interpreters, for enabling us to understand each other. Now, let us turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda, which is contained in document AB 152/1 and AB 152/1. In accordance with Rule 8 of Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 14 October 2022 to review the draft provisional agenda of the 152nd session of the board that had been circulated to member states on 27th June 2020. Proposals received from member states by the deadline of 19 September were considered, and the provisional agenda was agreed by the officers of the board. At this time, I would like to propose the deletion of the following agenda item, as I understand it is not needed. Item 24.1, Independent Expert Oversight Advisory Committee membership. This is being proposed for deletions since there are not any proposals on membership that have been put forward for the consideration of the board. May I take it that this proposal is acceptable? As I see no objection, it is so decided. Are there any further comments on the provisional agenda? I see Denmark. Denmark, the floor is yours.
Thank you, Chair. DG, fellow members of the Executive Board, colleagues, the European Union works closely with the World Health Organization on a wide range of subjects within the European region and on a global level. As agreed in the exchange of letters in 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without prejudice to any future conclusion of a general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Executive Board as an observer. As in previous EP meetings, we ask the Executive Board to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberations of the meetings of its committees and subcommittees, drafting groups, or other subdivisions thereof, in addressing matters falling within Union competence at this 152nd session of the Executive Board. Thank you, Chair.
Thank you, Denmark. If there are no further objections or comments, I think the agenda is adopted. It is adopted now. So let us now turn to two matters related to the officers of the board. First, board members may recall that at EB 151 in May 2022, Mr. German Escobar Morales of Colombia and Mr. Khairi Yamuluddin of Malaysia were elected as vice chairs from the region of the Americas and the region of the Western Pacific, respectively. Since then, I understand that Mr. German Escobar Morales and Mr. Khairi Yamuluddin are no longer available to serve in these positions. I understand that the region of the Americas and the region of the Western Pacific have consulted and proposed that Mr. Jaime Hernan Urrego Rodriguez, Herman Urrego Rodriguez of Colombia and Dr. Zaliha Mustafa of Malaysia be elected as vice chairs. Do I take that the board agrees with this proposal? Thank you. I can see that you do agree. Additionally, I would like to inform you that the region of Americas has brought to my attention a concern related to the lack of a formal mechanism to replace the officers of the executive board during the intersessional period, should they be unable to complete their term pending a decision of the executive board. Given the need to ensure an informed and full discussion of this matter, and taking into account the ongoing processes of existing reform, I would propose that this matter be considered in that context at the next meeting of the EB, without prejudice to the possibility for EB members to further discuss it at the next EB retreat. May I take this approach as acceptable to the board? I can see that you are with me, so there is no objection to it, and is so decided then. As you know, EB 152 has a heavy agenda, as I mentioned before, with 47 items and sub-items and more than 30 draft resolutions and decisions to be considered. It is important that we hold the meeting in a constructive manner. Once again, please post longer statements online and focus your oral interventions on the guiding questions projected on the screen. It is still possible to post your statements, the longer ones, online. I encourage you, EB members, to limit your interventions to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invite representatives of UN and other participating intergovernmental organizations and of non-state actors in official relations with WHO will be limited to 1 minute. But also, all of you can have your interventions posted. Regional and group statements will be limited to 4 minutes. I would also like to inform you that, as agreed, constituency statements by non-state actors in official relations will continue to be trailed during this meeting and will be provided on the following selected agenda items. Item 5, universal health coverage, reorienting health systems to primary health care as a resilient foundation for universal health coverage and preparations for a high-level meeting of the United Nations General Assembly on universal health coverage. Item 12.1, strengthening WHO preparedness for and response to health emergencies, strengthening the global architecture for health emergency preparedness, response, and resilience. Item 14, well-being and health promotion, and item 16, social determinants of health. Constituency statements will be limited to 3 minutes and will be delivered after all EB members intermingled throughout the discussions. When we move to the agenda items considered last week by the PBAC, I propose to build on the good work of the committee by focusing on discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. With the intention to ensure for all of us some rest every day, I will be very strict with time limits, and I ask you for your understanding. May I take it that these proposals are acceptable? Is there any comment? I see Germany. Germany, the floor is yours.
Thank you, Chair, for giving us this unusual opportunity to speak before the DG. First of all, we would like to congratulate you on your election as EB Chair. Germany would like to take the floor to express our confidence that your leadership, Madam Chair, will provide a meaningful oversight by steering the debate. We have discussed, and we will be discussing during this EB, many reform aspects in order to improve governance and to increase transparency, efficiency, and accountability. We are confident that the guiding questions will allow a more interactive debate and, in particular, will provide high-level oversight and guidance to the Secretariat on Member States' expectations. A conclusion of the main findings will allow us to follow up on how the Secretariat has been implementing our common will. We look forward to productive and interactive discussions during the next days. Thank you very much.
Thank you, Germany. Thank you for supporting me. If there are no other comments, I think the methods of work have been decided. Let us now review the preliminary daily timetable contained in document EB 152, DIV/2. It is proposed that the board meet each day from 10 to 13 and from 14:30 to 17:30. Some items are proposed to be discussed at fixed times. This morning, following the conclusion of item 1, the board will consider item 2, report by the Director General, which will be followed by item 3, report of the regional committees to the Executive Board. The board will then turn to the first bullet under the item 12.1, strengthening WHO preparedness for and response to health emergencies, strengthening the global architecture for health emergencies preparedness, response, and resilience. This afternoon at 14:30, the board will consider item 25.1, appointment of the Regional Director for the Americas. The first session will be a private meeting at which a secret ballot will be taken on the appointment of the Regional Director for the Americas. Upon confirmation, the reading of the oath and signing of the relevant documents will take place in a public meeting. Thereafter, consideration of this item will be suspended to permit the incoming Regional Director to join the meeting in person in Geneva. Following this, the board will return to the first bullet under item 12.1, strengthening WHO preparedness for and response for health emergencies, strengthening global architecture for health emergency preparedness, response, and resilience. On Tuesday, 31st of January, at 10, the board will consider item 4, report of the Program Budget and Administration Committee of the Executive Board, followed by item 20, budget and finance matters, including the discussion on sub-item 20.1, financing and implementation of the Program Budget 2022-2023 and outlook on financing of the Program Budget 2024-2025. And sub-item 20.2, proposed program budget 2024-2025. On Monday, 6th of February at 10, the board will consider item 23.1, matters emanating from the Working Group on Sustainable Financing, including the discussion on the AMSTG report and the Secretariat Implementation Plan on Reform. On Monday, the same day, 6th of February, at 14:30, the board will return to sub-item 25.1, appointment of the Regional Director for the Americas. Any statements on this item would be taken at this time, and regional or group statements are encouraged. This was originally programmed at 10 on 7th February, but to accommodate a virtual link with PAHO, we are proposing to shift to the afternoon on Monday. Finally, with respect to item 25.4, human resources, I would like to inform you that document EB 152/55, the Secretariat's report on the possible convocation of the special session of the Executive Board, will be considered on Saturday, 4th February at 10. Exceptionally, I propose that this matter be considered by the board in the restricted meeting, in accordance with Rule 7C of the Rules of Procedure of the board, and that the discussions be therefore confidential. This reflects the sensitive nature of the subject matter, as it is necessary to enable us to discuss this matter without compromising the integrity of the related procedure. To protect the confidentiality of the discussions, I propose that attendance at the restricted meeting be limited to members of the board, their alternates, and advisors. One representative of each member state not represented on the board, and of each associated member, as well as essential Secretariat staff only. The meeting will not be open to observers, intergovernmental organizations, non-state actors, and the public. Furthermore, the meeting will not be broadcast on the WHO website, and no official record of it will be made. The outcome will be announced in a public meeting. Please note that because of the confidential nature of the annex to document EB 152/55, it is available only to member states. It has been sent under confidential electronic cover to board members and the heads of member state delegations. Do I take it that the board agrees with these proposals? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. This concludes our consideration of agenda item 1. I think we are proceeding well. Let us now consider item 2 of our agenda, report by the Director General. It is my pleasure to give you the floor, Director General. You have the floor.
This is the story of how. No, is not just about eating your vegetables and growing taller. It's about how the world's people came together to help us all live long and healthy lives, making amazing discoveries like new medicines and vaccines, guiding us to grow up healthy, strong, and happy, keeping us safe from nasty diseases, painful ones, and deadly ones, and some horrible ones you've never heard of because they were completely wiped out.
The end of smallpox, the magnificent chapter in international collaboration.
Long-awaited malaria vaccine is a breakthrough for science.
Has finally been declared free of wild poliovirus.
It was really a story of human perseverance, innovation, commitment, bringing communities together towards one unified goal.
This is a story about all of us because we all played a role. And if we can keep working together, we'll make more discoveries, have more victories over diseases, and help even more people be healthy and happy in the future.
Thank you. I think we should repeat that video maybe at the end of my speech. It's a very nice one. A very smart girl, actually. Was not clear when it started, so a repeat will be important. Dr. Kristen Vesna Petrich, Chair of the Executive Board, Excellencies, Ministers, Heads of Delegation, dear colleagues and friends, good morning to all of you and a very happy New Year. 3 years ago today, I declared public health emergency of international concern over the global spread of COVID-19, the highest level of alarm under the international health regulations and for the moment, the only level of alarm. As you know, on Friday, the emergency committee met to consider whether that remains the case. The committee has advised me that, in its view, COVID-19 remains a global health emergency, and I agree. As we enter the 4th year of the pandemic, there is no doubt we're in a far better situation now than we were a year ago, when the Omicron wave was at its peak. But since the beginning of December, weekly reported deaths have been rising. In the past 8 weeks, more than 170,000 people have lost their lives to COVID-19. And that's just the reported deaths. We know the actual number is much higher. We can't control the virus, but we can do more to address the vulnerabilities in populations and health systems. That means vaccinating 100% of the most at-risk groups. It means increasing access to testing and early antiviral use. It means taking context-specific measures when there is a surge in cases. It means maintaining and expanding laboratory networks. And it means fighting misinformation. We remain hopeful that in the coming year, the world will transition to a new phase in which we reduce hospitalizations and deaths to the lowest possible level, and health systems are able to manage COVID-19 in an integrated and sustainable way. Vaccination will remain an essential part of our approach. We're now working to determine the most effective mechanism for advising member states and manufacturers on vaccine composition and vaccine frequency. At the Executive Board last year, I laid out 5 priorities for the coming 5 years as we work together to reinvigorate progress towards the 13th General Program of Work, the triple billion targets, and the health-related SDGs. Those priorities have since crystallized into what we're calling the 5 Ps: promoting, providing, protecting, powering, and performing for health. I wish to be very clear that the 5 Ps in no way replace the GPW or the triple billion targets, which remain the organization's guiding strategy. Rather, the 5 Ps are completely aligned with and contained within the GPW. All we have done is to draw them out of the GPW and package them in a way that highlights the key priorities on which we as one WHO, member states, and the Secretariat together must focus to accelerate towards the triple billion targets and the SDGs. Allow me to highlight some key achievements in 2022 against each of the 5 Ps, and by implication, the triple billion targets. First, promoting health by addressing the root cause of disease, which is essential for achieving our target of seeing the 1 billion more people enjoying better health and well-being. On tobacco control, we reached our target last year to support 100 million tobacco users to quit, but there are still an estimated 600 million users who want to quit and need our support. On trans fat, we have seen an almost 5-fold increase in the number of people protected by WHO recommended policies on the use of industrially produced trans fat, from 550 million people to 2.6 billion in just 4 years. But as you know, still 5 billion are unprotected, even if we protect 2.6 billion. Every year, more and more countries either increase or introduce a new health tax. For example, with support from WHO, Timor-Leste last year increased its tax on tobacco 5-fold, increased tax on alcohol, and introduced new taxes on sugar and sugary drinks. On maternal and newborn care, exclusive breastfeeding in infants under 6 months has increased from 38% to 48% globally over the past 10 years, bringing us very close to the target of 50% by 2025. We also reviewed evidence from trials in 20 countries that showed for the first time that immediate skin-to-skin care or kangaroo mother care can save almost 1/3 of children born preterm. On our efforts to make the world's roads safer, with WHO support and leadership, the UN General Assembly last year held its first high-level meeting on road safety. We also supported many countries directly, such as the adoption of new road safety legislation in Mexico and the development of a national road safety plan in Thailand, 2 countries with some of the world's highest rates of road fatalities. In our work against the health impacts of climate change at COP27 in Egypt, we launched the Alliance on Transformative Action on Climate Change and Health, which is supporting 63 countries to build climate-resilient and sustainable health systems. For example, in Mozambique, one of the most vulnerable countries in the world to the impacts of climate change, WHO has strengthened the Ministry of Health's capacity to monitor climate risks and impacts and to coordinate adaptation efforts. On aging, we led 12-country studies on the impact of aging on revenue generation for health, giving member states better data and policy recommendations. And WHO standards for safe listening were adopted by Apple, Huawei, Samsung, and Sony, enabling billions of people to take action to prevent hearing loss. The second priority is providing health. By reorienting health systems towards primary health care, which is essential for reaching our target to see 1 billion more people benefiting from universal health coverage. Last year, the special program on primary health care provided technical assistance to 119 countries hand in hand with ministries of health to strengthen the foundations of health systems. We continued supporting countries to strengthen their health workforce, which is the backbone of every health system. With international partners, we developed a global roadmap to invest in national public health workforce capacity. We have also added 8 countries to the WHO Health Workforce Support and Safeguards list for a total of 55 countries that need additional protection against active international recruitment. We launched the Nursing and Midwifery Global Community of Practice with more than 6,500 members from 180 countries. And in the coming year, we plan to launch a global campaign to provide access to basic emergency care training for 25% of nurses and midwives from 25 countries by 2025. On health financing, based on WHO guidance, 49 countries changed policies to remove financial barriers to essential health services, especially for COVID-19. We continue to support member states to expand access to essential medicines, which is a pillar of universal health coverage. In 2022, WHO recognized regulatory systems in 6 member states: China, Egypt, Nigeria, the Republic of Korea, Singapore, and South Africa, as having achieved maturity level 3 or 4, which means a stable, well-functioning system or advanced performance. And we issued a major update to our guidelines for biosimilars, making these complex medicines easier to evaluate for regulators and ultimately facilitating greater access for patients. On antimicrobial resistance, the tripartite officially became the quadripartite with the addition of the UN Environment Programme. WHO supported the development of new international targets to address the use of antimicrobials in humans, animals, and agriculture. 127 countries are now gathering data on antimicrobial resistance and consumption through the GLASS surveillance system, and 170 countries have national action plans to guide multi-sectoral response to AMR. All of this work is helping to alleviate suffering and save lives from all causes of death, disease, and injury. Last year, we supported dozens of member states to restore essential health services disrupted during the pandemic, including for routine immunization, where we saw the largest sustained decline in childhood vaccination in 30 years. As a result, 25 million children missed out on life-saving vaccinations, and catching up is now one of our highest priorities. For example, with WHO support, the Democratic Republic of the Congo has not just restored its routine immunization program to pre-pandemic levels, it has increased coverage by 5%. On non-communicable diseases, we published a new guideline on hypertension, and through the WHO Hearts technical package, 7.5 million people in 31 countries have been correctly diagnosed and put on treatment. We aim to double that number this year. India, for example, won the UN Award on Primary Care for its hypertension control initiative, which, by implementing the HEARTS package, has put 3.5 million people on treatment since 2018. On diabetes, member states adopted a set of global targets for the first time. And on cancer, we have supported 65 countries to improve access to quality care as part of the WHO Global Initiative for Childhood Cancer, a 50% increase from 2021. This year, we plan to provide medicines for all children with cancer in 6 countries with the goal of reaching 50 countries by 2027. Last year, WHO also supported multiple countries to develop national plans for cervical cancer elimination, including Maldives, Rwanda, Sri Lanka, and more. We're also making very encouraging progress on mental health. The WHO Special Initiative for Mental Health has now been implemented in 9 countries, expanding access to mental health services for more than 5 million people in Argentina, Bangladesh, Ghana, Jordan, Nepal, Philippines, Paraguay, Ukraine, and Zimbabwe. On communicable diseases, the COVID-19 pandemic was a severe setback. But in the past year, we have seen encouraging signs. On malaria, after increasing in 2020, the number of annual deaths appears to have stabilized, and cases increased at a slower rate. Meanwhile, the world's first malaria vaccine, RTSS, is saving lives. In Ghana, Kenya, and Malawi, where more than 1.2 million children have now received the vaccine, we see a substantial decrease in hospitalizations for severe malaria and a more than 10% drop in child deaths. Following WHO's recommendation for widespread use of the vaccine, at least 28 more countries in Africa are planning to introduce it, starting this year. On tuberculosis, based on WHO recommendations published last year, 109 countries are now using the first fully oral treatment regimens for multi-drug resistance TB. Realizing our vision for ending TB, we require new vaccines. The only vaccines we have, BCG, is 100 years old and does not adequately protect adults and adolescents. More than 16 candidate vaccines are in clinical development, and just 2 weeks ago, we established a ministerial-level TB Vaccine Acceleration Council to bring new vaccines to people as quickly as possible. On HIV, last year we published new guidelines on the use of long-acting injectables for preventing HIV, a potential game changer for those most at risk. So far, 4 countries have approved the use of long-acting injectables, and 10 are conducting implementation studies. The medicines patent pool has negotiated a voluntary license, and soon at least 3 generic manufacturers will start production. And every year, more countries eliminate more diseases. As we mark World Anti-TB Day today, we can be proud that in 2022, 8 countries were validated or certified for eliminating a neglected tropical disease: DRC, Equatorial Guinea, Malawi, Rwanda, Saudi Arabia, Togo, Uganda, and Vanuatu. Egypt also eliminated measles and rubella, and Oman eliminated mother-to-child transmission of HIV and syphilis. The third priority is to protect health by strengthening the global architecture for health emergency preparedness, response, and resilience. In 2022, WHO responded to 72 graded emergencies across all regions, including 3 public health emergencies of international concern: outbreaks of Ebola and cholera, conflicts in Ethiopia, Syria, Ukraine, and Yemen, and humanitarian crisis in the Greater Horn of Africa, the Sahel, and much more. Thanks to the generosity of donors to the Contingency Fund for Emergencies, we were able to release more than $87 million immediately to support rapid response. And we delivered essential health supplies to 90 countries from our Dubai logistics hub in the United Arab Emirates. Last year, we also launched the first consolidated WHO Global Health Emergency Appeal. And just last week, we launched this year's appeal for $2.5 billion. Of course, WHO does not act alone. In 2022, we worked with thousands of partners through the Health Cluster, GORN, emergency medical teams, and more. We continue to work with partners in building a rapidly deployable health emergency core for future health emergencies. We continue to support countries to respond to the COVID-19 pandemic with up-to-date technical guidance, training, and support for health workers, convening experts to advance science, and much more. Through our partnerships in the ACT Accelerator and COVAX, we supported the provision of more than 1 billion vaccines and procured 320,000 courses of antivirals. The number of countries with less than 10% of vaccination coverage reduced from 34 at the beginning of last year to 9, averting thousands of hospitalizations and deaths. In July, I declared a public health emergency of international concern over the global outbreak of mpox. In total, more than 85,000 cases and 86 deaths have been reported to WHO from 110 countries. The number of weekly reported cases of mpox has now declined significantly, although 36 countries in all 6 regions continue to report new cases. In September, the government of Uganda declared an Ebola outbreak. Working with many partners, we supported the government to respond to and extinguish the outbreak. During the outbreak, WHO's R&D blueprint for epidemics, working with the Ministry of Health and Ugandan researchers, coordinated a global coalition of partners to accelerate the availability of investigational doses of 3 candidate vaccines and rapid preparation for the integration of vaccine research in the response. Last year also saw an unprecedented number of cholera outbreaks reported in 30 countries, with a massive increase in the number of people with affected countries who are now at risk. In response, WHO supported large-scale vaccination campaigns and provided cholera kits to treat more than 500,000 people. In Haiti, one of the worst affected countries, WHO PAHO has delivered more than 1 million doses of oral cholera vaccines, and almost 3/4 of those eligible have received 1 dose. We have now raised the global cholera crisis to grade 3 emergency, the highest level in our internal grading system, due to the high case fatality, the potential for further spread, and severe limitations in vaccine supply. On polio eradication, after an all-time low of just 5 wild polio virus cases in 2021, we saw an increase last year, with 20 cases in Pakistan, 2 in Afghanistan, and 8 in Mozambique. However, no cases of wild poliovirus have been reported since early September last year. In addition, last year, 3 million children previously inaccessible in Afghanistan received polio vaccines for the first time. And in October, donors pledged $2.6 billion to support the work of WHO and our partners to consign polio to history. At the same time, as part of the polio transition, we have integrated polio assets in more than 50 countries to support immunization, disease detection, and emergency response. As you know, last year the Secretariat reviewed more than 300 recommendations from multiple reviews on the future of preparedness and response to pandemics and other health emergencies. Based on that analysis, we made 10 key proposals for strengthening the global architecture for health emergency preparedness, response, and resilience. This includes actions for stronger governance, stronger financing, stronger systems and tools, and a stronger WHO. The framework will enable us to converge and align the many different activities and initiatives that member states, multilateral agencies, and others are undertaking. This is especially critical as member states begin negotiations on a zero draft of a legally binding pandemic accord, in addition to ongoing discussions on amendments to the international health regulations. In November, under the leadership of Indonesia's G20 presidency, a new pandemic fund was established at the World Bank, with WHO playing a central role, including as chair of the technical advisory panel. The WHO Hub for Pandemic and Epidemic Intelligence is now fully operational, and last year engaged with almost 250 institutions around the world to foster collaborative surveillance and intelligence. And 4 countries have now completed the pilot phase of the Universal Health and Preparedness Review: Central African Republic, Iraq, Portugal, and Thailand. We're also now convening a process to create an end-to-end platform for equitable access to medical countermeasures, building on the lessons from the ACT Accelerator, the PIP framework, and other mechanisms. The 4th and 5th priorities are enablers of the first 3 and the triple billion targets. The 4th is to power health by harnessing research, innovation, data, digital technologies, and partnerships. On research, we established a grant program for young researchers from low and middle-income countries on NCDs. 8 were chosen from Cameroon, China, Egypt, Ethiopia, India, Peru, and Uganda. We also created a behavioral science unit which has run training in 4 regions, provided technical assistance for pilot projects in several countries, and contributed to our work on AMR and nutrition. On innovation, the mRNA Hub in South Africa has started transferring technology to manufacturers in 15 countries and the biomedical training in Korea. And we launched a mobile app developed for health workers in humanitarian emergencies to improve delivery of WHO child health recommendations. On data, we completed the beta version of the World Health Data Hub, providing a single source for publishing health data, addressing the fragmentation problems we had. The Data Hub will be made publicly available this year. And 76 countries are now actively implementing the 11th edition of the International Classification of Diseases, providing better data to support better policy decisions. On digital health, with support from WHO, more than 120 member states have developed national digital health strategies to guide their health system transformation. We have provided training for 600 health leaders in 103 countries on digital health strategy, governance, and implementation. And our leadership led to a global consensus on a technical interoperability standard for COVID-19 certificates, which are now in use by over 120 countries, enabling over 3 billion people to use digitally augmented vaccine and test results. On partnerships, last year we held civil society dialogues on climate and health, mpox, UHPR, TB, sexual misconduct, and more, and working to establish the Civil Society Commission before the Assembly. We engaged with parliaments and the private sector. And just this weekend, we held the first meeting of the WHO Youth Council. Yesterday, the delegates briefed me on their proposals to accelerate progress on UHC, NCDs, mental health, and youth leadership. And I would like to join our chair, Dr. Petrich, to encourage all member states to meet our youth there in the compound, at least for today, if there are issues you would like to discuss. But at the same time, we ask you to include youth representatives in your delegations to the World Health Assembly. And also, we expect gender parity also of the delegation to the Assembly. And our partnership with Qatar and FIFA enabled us to reach billions of people globally with messages about physical activity and more during the World Cup in November in Qatar. And that's the first time, and learned a lot, and a successful one. The fifth and final priority is to perform for health by building a stronger WHO that delivers results and is enabled and empowered to play its leading role in global health. As member states, you look to us to provide world-class evidence-based norms, standards, research data, and technical and operational support. And that's what we're doing. Last year, we produced 213 global public health goods, including key reports and guidelines on artificial intelligence, disabilities, marketing of milk formula products, oral health, physical activity, priority pathogens, refugees and migrant health, safe abortion, and much more. In addition, the WHO Science Council published its first report on accelerating access to genomics for global health. Through our open WHO learning platform, 7.5 million learners from all member states accessed 190 courses in 67 languages. Open WHO will be an important part of the new WHO Academy, which will play a key role in building the capacity of the global health workforce, including WHO's own staff. We have now finalized an updated business model for the Academy and are developing a catalog of courses that respond to major global health challenges and the needs of health workers. With the strong support of France and other member states, the Academy is mobilizing new resources to ensure its sustainable financing, and we expect the Academy Campus Hub in Lyon to open its doors in September 2024. We're committed not only to building an even more experienced, qualified, and talented WHO workforce, but also to creating a workplace that allows our people to be and do their best. For a decade, WHO has given special attention to fostering a workplace where all staff are respected, enabled, and protected through the Respectful Workplace Initiative and related efforts on diversity, equity, and inclusion, mental health at work, flexible working arrangements, and more. From 2023, this initiative will transform into a dedicated program with fixed staff and resources to focus on sustained cultural change. Recognizing that talent is universal, but opportunity is not, we also launched the Young Professional, we're launching the Young Professional Program to give junior professionals from least developed countries the opportunity to work with WHO for 2 years, then take the experience they have gained back to their countries. The first round has been completed with 14 young professionals recruited from Afghanistan, Bangladesh, Bhutan, Chad, Sudan, Madagascar, Malawi, Myanmar, Nepal, Senegal, Sierra Leone, Tanzania, Uganda, and Zambia. This program started in partnership with Buffett Foundation. I'd like to thank Buffett Foundation, and Professor Sarnait is with us today. And I believe this program, if expanded, will be a game changer that helps especially the low-income countries to build capacity. And we will take more young professionals to have a stay with us for at least 2 years to build capacity and back home to better serve their countries. Last year, we also took strong action on mainstreaming gender in our work by developing an internal policy and strategy, updating our gender parity policy, and championing gender equality, human rights, and equity, both internally and externally. Programs such as polio and health emergencies now have specific programmatic strategies to promote gender equality, which are strengthening our country operations. And for the first time in WHO history, we have reached overall gender parity for staff across all appointment types and categories of positions. As you know, 2022 was a landmark year for our work, for our organization, with the agreement by member states to increase assessed contribution to 50% of the base budget over the next decade. The program budget for the next biennium, which you will consider this week, includes the first increase in assessed contributions, if approved, of $200 million. This is also the program budget in which country office will be allocated more than half of the total budget of the biennium. Strengthening our country offices is a key priority. For the past 3 weeks, 6 country representatives have been working to develop a 100-day plan of action in 7 critical areas, including core presence in country offices, rotation and mobility, adequate and predictable financing, delegation of authority, and more. Some of these actions are already underway through the transformation, and others will be implemented immediately after the plan of action is finalized and agreed. To support this initiative, in the coming year, we will be working closely with 45 country offices using a delivery for impact approach to focus on the highest priority, highest impact interventions. As a complement to the increase in the assessed contributions, the Secretariat is also proposing a new replenishment process which we will submit to member states for consideration. We recognize that with increased flexibility and sustainability comes increased expectations for transparency, efficiency, compliance, and accountability, meaning all this leading to result. As you know, we have made progress on preventing and responding to sexual misconduct, and I will have more to say about our ongoing work in this area when we address the agenda item. I thank the Agile Member State Task Group for its recommendations, which have been incorporated into the monitoring mechanism to track progress on the Secretariat's implementation plan on reform. The implementation plan contains 98 actions, 38 of which have already been completed. We will continue to implement the remaining actions, and we look forward to the board's support and continued oversight. We appreciate, as you do, the delicate balance between the governance role of member states and the management responsibilities of the Secretariat. We all want a WHO that's agile, proactive, and able to move quickly to respond to global health threats. The Secretariat is committed to implementing the priorities and plans of member states as agreed at the World Health Assembly. In turn, we ask member states to give the Secretariat the necessary latitude to carry out our mandate to achieve those priorities and plans. Excellencies, I have tried to give you a taste of the huge scale and scope of work that your organization does and that your agenda this week reflects. But it's only a test. I have barely scratched the surface. It's impossible to do justice to the work we're doing around the world. And none of it is possible without the people who make WHO what it is. I do not have the words to express my gratitude, admiration, and respect for my colleagues, staff, consultants, contractors, JPOs, and interns, G-staff, P-staff, which I don't like the division, directors, assistant director generals, executive directors, and regional directors, from the front lines to the back office, in mega cities and remote islands, working on the big picture and the small details. As you know, this year marks our organization's 75th anniversary. This anniversary belongs to all of us, to every member state, and to every member of staff. This is our opportunity to tell our story and imagine our future. Accordingly, I have asked every country and regional office to design a localized campaign to celebrate WHO's achievements in every corner of the world. We have a lot to be proud of over the past 75 years. But it's not the past 75 years that matters. It's the next 75. Not the past 5 years, but the next 5. Not yesterday, but tomorrow. We look back with pride so that we can look forward with hope. We learn the lessons of the past so we can apply them in the future. Thank you for your confidence and trust. We're proud to be WHO, proud to be your WHO. I thank you. Maybe if we can have the video with your permission, Madam Chair. It's a very short one.
Since 1948, thanks to the diversity and the commitment of its 194 member states, the World Health Organization has had a profound impact on improving the health of human beings around the world. The collective work of WHO member states has led to the eradication of smallpox. The Framework Convention on Tobacco
It helps with the phones, headphones.
WHO Framework Convention on Tobacco Control are adopted.
The international health regulations.
Se adopta la resolución y por consiguiente se aprueba el tercer informe de la Comisión A.
And the decision to establish an intergovernmental negotiating body to develop an instrument for pandemic prevention, preparedness, and response. So, how do member states work together to achieve tangible results? The World Health Assembly, or WHA, is the decision-making body of WHO and is comprised of its member states and associate members. In May, all delegates come together to lead the way. They agree on WHO policies, approve its budget and priorities, and every 5 years, they appoint the Director General of WHO.
Appoints Dr. Tedros Adhanom Ghebreyesus as Director General of the World Health Organization.
The Executive Board, also known as the EB, acts as an executive body to prepare and support the work of the WHA. The WHA and the EB adopt resolutions which offer the collective recommendations of the member states. How did WHO member states respond to the disruption and tragedy of the COVID-19 pandemic? With nearly triple the number of intergovernmental processes to work through, member states worked day and night, making vital decisions that would improve the lives of billions. Strengthening preparedness and response to health emergencies became an urgent need. WHO member states have worked tirelessly towards a pandemic instrument, as well as filling gaps from the international health regulations of 2005. Finally, they decided to strengthen WHO's governance and financing to better serve those who need it most. The dedication of WHO delegates to the advancement of human health is remarkable, finding common ground between the visions of 194 member states as they continue across generations, geographies, time zones, cultures, and languages.
Happy 75th anniversary to the World Health Organization. We, member states, and the Secretariat make our organization strong.
We are WHO.
Thank you, Dr. Tedros. Thank you for such an excellent report. I think we are all impressed. And actually, I think we are all impressed what has been done, not only by Secretariat, but by all of us, member states, partners, together. It's really important to understand the strength of this. Also, thank you very much for paying so much attention to the young people. They are our future, we all know, but they are also the ones that can think out of the box. being so innocent still. And I think we should consider them as a very important partner. And thank you, I have to say this since I'm a woman, to pay so much attention to women as well. Thank you very much. I think that we now can open the floor for discussions. And kindly, please raise your nameplate should you wish to take the floor. I see Denmark. Denmark, the floor is yours.
Thank you very much, Madam Chair, Director General, fellow members of the Executive Board, Excellencies and colleagues. I'm delivering this statement on behalf of the European Union and its 27 member states. The candidate countries of North Macedonia, Montenegro, Albania, Ukraine, Republic of Moldova, as well as Bosnia and Herzegovina, align themselves with this declaration. The EU wishes to thank the Director General for his extensive report, and we take note of the continued global health challenges over the last year. Unfortunately, we have reason to believe that many of these challenges will remain in 2023. Russia's unprovoked, unjustified and illegal war of aggression against Ukraine continues. This grossly violates international law and the UN Charter, and it undermines international security and stability. We condemn Russia's military aggression against Ukraine in the strongest possible terms, and we express full solidarity with Ukraine and the Ukrainian people. We also stress that Russia must always respect its responsibilities under international humanitarian law. To this date, nearly 750 attacks on healthcare have been verified in Ukraine. The Office of the UN High Commissioner for Human Rights has reported a total of 17,023 casualties in Ukraine since the war began on the 24th February of 2022. Furthermore, the military aggression has triggered energy and food supply challenges, exacerbating existing food system vulnerabilities that have already been weakened under the effect of climate change and the COVID-19 pandemic. The huge impact of conflict on health and well-being of people and societies is the case in all ongoing conflicts across the world. Director General Dr. Tedros, we commend the WHO for its effective response to new emergencies over the past year, including Ebola in Uganda, as well as the outbreak of Mpox. We support the Director General and the WHO's inclusion of human rights and non-discrimination perspectives in these responses. The COVID-19 pandemic is not over. We need to monitor and assess the situation continuously, and we need to integrate the lessons learned from the pandemic. We reiterate the need for continued leadership at all levels of multilateral cooperation and for a modern and effective international system where actors have distinct and well-defined complementary roles and responsibilities. The WHO has a central role to play in delivering on the SDGs through its mandate to provide leadership, knowledge, advice, and technical support to all countries, as well as through its convening role. Fostering inclusive collaboration of international actors and counteracting fragmentation, also beyond the emergencies agenda, is crucial for an effective international system, leaving no region of the world behind. The EU remains committed to reforming the international system for pandemic preparedness and response, and to strengthen the legal and normative framework for pandemic and emergencies response through the revision of the international health regulations and an international pandemic agreement. We stand ready to engage in constructive dialogue and negotiations in the working group for IHR and in the INB, and we look to the respective bureaus to facilitate and lead these processes and work together with member states for successful outcomes. We look forward to work together to contribute to successful outcomes at this year's high-level meetings of the UNGA in New York, on UHC, on TB, and on pandemic preparedness, prevention and response. Finally, the EU wishes to acknowledge the inclusive process to develop a draft program budget with a stronger country focus in line with the objective of the GPW 13 to strengthen country capacities and to accelerate progress towards the achievement of the triple billion targets and health-related sustainable development goals. We are ready to consider and support the 5 priorities of the GPW and at the same time wish to emphasize the importance of delivering the objectives of the GPW in its entirety. We wish to stress that implementing the reforms on WHO financing and enabling functions will be crucial for WHO to deliver. This includes an increase of assessed contributions and exploring a possible new replenishment mechanism, as well as further increased transparency, accountability, compliance, and efficiency. Thank you, Chair.
Thank you, Denmark. I now give the floor to Botswana. Botswana, the floor is yours.
Thank you, Chair. The African member states thank the Director General for his report, which takes stock of where the organization has come from and priorities for the coming years as we deliver on the general program of work. As the DG recalls, it has now been 3 years since the WHO declared COVID-19 disease a global pandemic. The WHO has played a central role as the leading international organization in public health to support countries in managing the pandemic. We therefore call for strengthening the WHO as the leading authority in global health governance, which can deliver at the country level. This is particularly important in light of emerging and re-emerging infectious diseases, increasing burden on NCDs, neglected tropical diseases, hunger, and climate change. The inequities between and within countries persist, which reverse or stalls progress towards achieving or achievement of the SDGs. With respect to the COVID-19 situation, we note the significant achievements, including development of safe and efficacious vaccines, therapeutics, and diagnostics in record time. We, however, note with great concern that since the beginning of December, the number of weekly reported deaths globally have been increasing. At the same time, surveillance and genetic sequencing have declined dramatically around the world, making it more difficult to track down variants and detect new ones. We therefore request the WHO to continue to support the countries in this regard. We congratulate the member states on the extension of the GPW 13 and the Secretariat work to monitor the progress towards the triple billion targets and the health-related SDGs. We also welcome the DG's proposed 5 priorities, which have crystallized into the 5 Ps that align with the GPW 13 extension. Indeed, impact can only be achieved through close coordination with and support to the national health authorities. As such, the strengthening of country offices is instrumental, with particular focus on strengthening national health systems and on promoting more equitable access to health services. The majority of countries with UHC index that is below the global median are in the WHO Africa region. And for that reason, we call on the WHO to enhance capacity at the regional and national levels in order to accelerate progress. Currently, the regional office needs both technical and financial support in order to effectively address and support country needs. Chair, the proposed program budget of 2024-2025 marks an important milestone, as it is the first in-program budget in which country offices will be allocated more than half of the total budget for the biennium. We highly welcome this approach, which will enable the organization to deliver on its mandate while fulfilling the expectations for transparency, efficiency, and accountability. The African member states, therefore, call on the DG to ensure equitable resource allocation, in particular to address the budget and funding imbalances by increasing the program budget share of countries and regions to 75% for 2024 to 2025. We would like to reiterate that addressing the program budget imbalance is a key governance reform, a precondition to the increase in assessed contributions. The African member states are fully committed to working with the WHO, other member states, and partners, including at the country level, in order to advance our SDGs and end the COVID-19 pandemic. I thank you.
Thank you, Botswana. Thank you for keeping the time. Now I will give the floor to the member states, and remember, you have 3 minutes, and also remember, you can still post your statements on the web, so everybody can read it. Brazil, the floor is yours.
Thank you, Chair. Allow me to thank you also for your leadership. Dr. Tedros, dear ministers, distinguished members of the Executive Board, Excellencies, colleagues, ladies and gentlemen. Dr. Tedros, thank you very much for the comprehensive report and for sharing your vision for the future of WHO. As we all know, Brazil started in January a new phase in its history, a phase where democracy, health, and respect for human rights, gender balance, racial equality, and the rights of indigenous people walk hand in hand. Please allow me to introduce to you the new alternate representative of Brazil, the new Vice Minister of Science, Technology, Innovation, and Health Economic Complex of the Minister of Health, Dr. Carlos Gadelha, with whom I will have the honor of sharing these opening remarks.
Thank you, Ambassador, dear Director General, dear Chair. It's my honor to address you today on behalf of Minister Nízia Trindade Lima, the first woman to be Minister of Health in Brazil. The nomination of a representative of science and technology from the Ministry of Health expresses a clear indication of the centrality of science in our minister's mandate. Brazil is back. Science is back. Brazil is fully committed to local and regional production to support our universal health system and reduce health vulnerabilities and world asymmetries. Health is a priority of President Lula's administration, considered as a driving force for development that brings together the social, economic, and environmental dimension. We also reinforce the commitment to take care of our people, emphasize comprehensive primary health care and preparedness for health emergencies. Brazil will work with all other partners to improve the respect for human rights, in particular when it comes to gender and racial equality, sexual and reproductive health and rights, fight discrimination based on sexual orientation and gender identity, and promote the rights of people with disabilities and indigenous peoples. In this regard, I would like to announce our intention to put forward a resolution on the health of indigenous peoples, a topic never addressed directly before by the World Health Assembly, with the objective of ensuring the right to health, according to their own requirements and under their own administration. It's very important. We count on the support of other member states, the WHO, as well as other international organizations, and all others that care about not leaving anyone behind, in order to give the proper recognition of this important issue that has been so often neglected. Around 600 indigenous children died in the last 4 years as a result of neglect by the state and the lack of public policies. There is no sustainable development. There is no right to health in a situation where children die due to abandonment. In this regard, the support for the resolution on the health of indigenous people is also support sustainable development, the Amazon, and the right to health in the global context. Thank you very much.
Thank you, Brazil. I now give the word to USA.
Thank you, Madam Chair, and good morning to everyone. I want to, on behalf of the U.S., thank DG Tedros for his report and express my appreciation to him for starting his remarks regarding the COVID-19 pandemic, because although as the world seems to move on from this crisis, we see that the pandemic is not quite done with us yet. So given that new variants continue to circulate, we support efforts to continue to bolster health systems and protect those who might be most marginalized, and we recommit, along with others here, to work together to end the acute phase of the pandemic, working in solidarity with others to equitably address the needs of people worldwide. And as our colleagues from Brazil said, follow the science in that effort. I want to offer remaining remarks using the framework that Tedros provided us. First off, providing health. The U.S. prioritizes efforts to promote universal health coverage through strengthening primary health care and protecting people from catastrophic spending. We also support UHC and its efforts to increase access to health services, including sexual and reproductive health and rights. And then finally, we think it's quite important to take action on the critical links between climate change and health, and appreciate WHO's focus in that regard. We want to emphasize one important area, though, in this space, and that is to express the U.S. focus on ensuring the health and rights of lesbian, gay, bisexual, transgender, queer, and intersex individuals and communities, because we will not accept intolerance or discrimination of any people. We look forward to the EB's discussions in this area and will continue working with all partners to improve health and increase inclusion, empowerment, and equality. In the realm of protecting health, we want to thank headquarters and regional and country teams in their efforts to address health emergencies in the past year. Obviously, the U.S. is equally committed to the success of the intergovernmental negotiating body. We also believe the working group on international health regulations is a process that should be mutually supportive along with the INB. These are two historic negotiations, and so we're pleased that so many member states are engaging in them, and in particular, offering targeted amendments for reviewing and strengthening the IHRs, and so the U.S. is committed to the success of both. And in the category of performing, we, member states this week, will take steps to further strengthen and reform WHO, as has been mentioned, in terms of its effectiveness, its sustainability. We look forward to discussing the proposed 20% increase to assess contributions for WHO's budget, and we appreciate WHO's continued commitment to further improve its transparency, oversight, and accountability to member states, as outlined in the Secretariat's implementation plan on reform and the reforms proposed by the Agile Member States Task Group. Also in this area, we want to ensure that we remain focused on protection from sexual exploitation and abuse and sexual harassment, because that likewise remains a core priority for the U.S., and we're happy to see the PBAC's recommendations in this area. And finally, with apologies for going over, I do want to align with the statements from the European region regarding the premeditated and indefensible aggression in Ukraine by Vladimir Putin. And we strongly condemn this brutal and unprovoked, unjustified war against Ukraine, and we continue to stand with Ukraine and its people in this crisis.
Thank you, US. May I again invite you to keep the time, please? And now I'm inviting Republic of Korea. The floor is yours, Korea.
Thank you, Madam Chair, and thank you, Dr. Tedros, for your fantastic report. The COVID-19 pandemic situation is getting better through our 3-year fight. This will be another achievement we have made in our 75 history of WHO. However, the COVID-19 threat is still alive. The Republic of Korea is deeply concerned that the adverse impact of the pandemic caused grave disruption to the progress in UHC, and inequitable access to COVID-19 countermeasures remains unaddressed globally. Tackling the challenges require close collaboration with a clear target and direction. As DG mentioned, we already have a good guidance, extended GPW13 and triple billion target. Building on 5 Ps, I hope that the proposed program budget 24-25 to be more closely aligned with the GPW13 through the EB meeting. Above all, given that a 20% increase in assessed contribution is reflected according to Working Group on Sustainable Financing recommendation, The proposed program budget 24-25 is significant, and it is grateful that the Secretariat suggests an implementation plan to strengthen budget accountability based on AMSDG report. My delegation supports an essential role that the sustainably financed WHO has to play in the global health area. With regard to the development of a new global health architecture, we look forward that the INB will start the negotiation on the pandemic treaty that will provide a framework for future pandemic prevention, preparedness, response, and recovery. As Dr. Tedros indicated during the third INB meeting, 18 months is not enough time to conclude the negotiation. However, we should not miss the window of opportunity. I hope that we avoid overlaps between pandemic treaty and the IHL revision discussion, and that they are closely linked with each other efficiently. And I also look forward that we can make IHL amendment and develop guidelines to ensure smooth movement and the delivery of essential health workers and goods in the face of health crisis. Lastly, our government agrees that we need to keep expanding efforts to ensure equity in pandemic countermeasures, including vaccines and medicines. Last year, the Republic of Korea, as the WHO Global Biomanufacturing Workforce Training Hub, successfully provided the training about vaccine and biomanufacturing and quality management to trainees from 43 countries. This year, my country will scale up the training program, which enables us Korea to contribute to the enhancement of the capacity of infectious disease response. I kindly ask the attention and support from the member states and the Secretariat. Thank you.
Thank you, Korea. We are not doing really well, dear EB members. Please try to do what we have agreed upon during the EB and keep the time, because by doing so, we will have more room for discussion in other important items. And as I said, we can all post our long statements on the web, so everybody can read it. So now I give the floor to India.
Thank you, Chair. Chair, India would like to thank Director General for a comprehensive report and outlining his vision for WHO. India would also like to congratulate the Director General on his re-election and conveys India's support as he embarks on his second term. India commends Director General for his leadership, especially at a time when we are faced with an unprecedented global health crisis during COVID-19. This is also a testimony of member states' appreciation and confidence in the Director General's stewardship and commitment to global health at a time this once-in-a-century crisis. The pandemic has shown the urgent need for strengthening global health architecture and for building a resilient global health system, with WHO being at the center of these efforts. Over the past 2 years, member states have taken steps to make WHO fit for purpose and fit for our collective future. Chair, India as the G20 presidency has accordingly identified priorities with focus on health emergencies, prevention, preparedness and response, along with One Health and AMR, strengthening cooperation for access and availability to safe, effective, quality and affordable medical countermeasures, and digital health innovations and solutions so as to achieve universal health coverage and improve health service delivery. India believes that it is important that learnings from challenges posed by COVID-19 should not be lost sight of. With waning trajectory of COVID-19, the fact that whole world, both developing and developed countries alike, were brought to their knees by the pandemic, it is crucial that we should not return to business as usual. We need to maintain collective momentum to ensure that the world is better prepared for managing future health emergencies. In that context, as prioritized by India's G20 presidency, it is important that we should collectively create a non-fragmented and non-siloed global health architecture and also create R&D and manufacturing networks for drugs, diagnostics, and vaccines, besides having a global medical countermeasures coordination platform with specific focus on LMICs. India looks forward to the Director General's leadership and WHO's support for member states' efforts in harnessing new technologies and innovation to enable equity and achieve universal health coverage. Chair, India is committed to work with all member states and WHO to undertake all what is needed and to initiate required steps and processes to facilitate achievement of these global health goals. Thank you, Chair.
Thank you very much, India. I now give the floor to Oman. Oman, the floor is yours.
Madam President, Honorable EP members, ladies and gentlemen, I would like to express my pleasure for joining 152nd Governing Body meeting of the WHO, and I am pleased to convey our appreciation for the report of the Director General under this agenda item. For the past few years, we have seen how health emergencies have hampered the work toward achieving the SDGs and the ambitious triple billion target. The pandemic have also indicated the urgent need for solidarity and global health system that is resilient and responsive. We in the Sultanate of Oman value the work of the WHO and emphasize the importance of placing the WHO at the center of the global health architecture, building in lessons gained from the pandemic. Here, I would like to appeal to every one of us, member states, and as well as the Secretariat, to benefit from these lessons and to turn the huge challenges into greater opportunities. This is achieved through solidarity and partnership, aiming to establishing strong health systems that exhibit justice, equality, affordability, and advancement for health. We also see the importance for the WHO to deliver results across its 3 levels of organization, with particular emphasis on the country level. Our vision for the future had become clearer than before. The financial mechanisms of our organization is growing more positively to be more sustainable. And the trust of people in the WHO was never better than it is now. We just need to proceed forward. Mr. DG, we have full trust in your wisdom and your leadership. The Sultanate of Oman remains steadfast in their commitment to reinforce initiatives for the achievements of the triple billion targets, acknowledging the need to extend deadlines because progress towards the SDGs is not occurring fast enough and was even stalled in some areas. Thanks, Mr. Chairman.
Thank you, Oman. I now give the floor to Malaysia. Malaysia, the floor is yours.
Madam Chair, Dr. Tedros, ladies and gentlemen, greetings and Happy New Year. It is indeed a profound honor for me to lead the Malaysian delegation as an executive board member for Western Pacific region and to participate in this 152nd sessions of WHO's Executive Board meeting in Geneva. My appointment as Health Minister under the Premier of the Unity Government comes at a crucial time, intersecting global crisis with a resurgence of the COVID-19 virus caused by highly transmissible new Omicron subvariants, deteriorating climate conditions and natural ecosystem in struggling economic growth. Being the very first woman in Malaysia to hold this position gives me a great sense of pride, as I have always been passionate about striving for girls and women around the world to believe in themselves and to soar to greater heights. Moving forward this year, we have a high commitment to work together to address critical gaps that remain in health emergency prevention, preparedness and response, including strengthening international health regulations and the potential amendments, in addition to brainstorming at the Intergovernmental Negotiating Body meetings. Malaysia believes that the targeted amendments proposed will further enhance global health security with respect to the principle of equity, accountability, and transparency, and the sovereign process of member states. As chair of the Standing Committee for Health Emergency Prevention, Preparedness and Response, Malaysia will continue to work closely with the members. As we have heard today, the gravity of the NCD epidemic is increasing in all countries, and one of the greatest disease threats in the Western Pacific region, which accounts for 87% of all deaths in 2019. We see disturbing trends of late, whereby NCDs are affecting younger people. This is a solemn reminder for us all to keep preserving with the preventive work being done around the globe. In this regard, I wish to acknowledge the WPRO's Regional Action Framework for NCDs Prevention and Control. It paints a roadmap to transform our healthcare system to turn a sick system that focuses on treating diseases into a health system in which countries invest in health environments, behavior change, and NCD preventions and early detections. At this juncture, I'm delighted to highlight the great work done by the team to champion the agenda of behavioral science for better health. I sincerely wish to thank all our co-sponsors and member states who had actively participated in the series of informal consultations that took place for the resolution. I humbly seek the board's support and consensus to move forth the draft resolution at the 76th World Health Assembly. We are cognizant of the barriers that people globally face in accessing healthcare. The social determinants of health need to be addressed as we adopt a health in all policies across ministries. I wish to take the opportunity to briefly speak on global surgery. It is imperative for us to explore on pooling of resources among the member states in terms of asset, training of both surgeons and non-doctors, medicines and supplies. Malaysia would be delighted to host a side event at the upcoming 76th World Health Assembly in May. We welcome the support of our fellow executive board members and look forward to innovative viewpoints on surgical care system strengthening. Malaysia's in-kind contribution to WHO by hosting a global service center on our soil over decades is something we take great in pride. We look forward to signing the renewal of the host country agreement of Tedros tomorrow. I wish to reiterate what Dr. Tedros mentioned at the extensions of the general program work in January 2022. Although we have progressed, it's clear that we are far behind where we need to be, especially in relation to universal health coverage. On that note, I thank you for your attention and may we all have a fruitful and productive session at this EB. Thank you, Chair.
Thank you very much. Once again, we have agreed that those things of national importance to be shared with other countries for us to understand the national context of other countries should be preferably put on the web, and then everybody can read it, and we spend more time on those issues that are really relevant to us all. So I have on my list China, Colombia, Belarus, Japan, Morocco, UK, Russia, Afghanistan, Timor-Leste, so many countries. So please try to keep time, and I'm very sure that everybody will be really interested and to read the long statements with the national information, which is very precious later on. So I give now the floor, as I said, to China. China is first now on my list. The floor is yours, China.
Thank you, Madam Chair. China thanks the DG, Dr. Tedros, for his report and appreciates the Secretariat's efforts in coordinating a COVID response, promoting global health security, and the WHO governance reforms. The COVID pandemic is still spreading across the globe, threatening public health. In addition to new trends, the new variants have become far more infectious. Together with other respiratory diseases, they continue to spread across the globe, threatening and undermining national health systems. Based On the global trends, China in general has gone past the incidence peak at a relatively low new infection rate level. The Spring Festival witnessed frequent population flows and public gatherings, during which period China still sees an overall stable domestic situation, and the variants come from Omicron. China stays in close communication with WHO by sharing information, uploading variant details to the global database. China always supports the WHO's leadership in global health efforts. It supports the WHO in coordinating a response to COVID. We will always support the Secretary's work and work with others to implement 5 priorities proposed by the DG and attend to the mechanism of the pandemic court negotiation and other negotiations. We hope the Secretariat can focus on the Member States' needs to promote their health systems. We hope the Secretariat can continue to enhance communication and coordination to make its work more science-based, transparent, and impartial, to explore ways to increase WHO's financial sustainability, to continue corporate governance reforms, and to work with Member States to address health emergencies and build a global community of health for all. Thank you.
Thank you, China. Thank you for keeping the time. Next on my list is Belarus. Belarus, the floor is yours.
Спасибо. Thank you. Thank you, Madam Chair. I would like to thank the Director General for his report, very broad report. We welcome the efforts of the DG over many years to adapt the organization to the modern world, obviously strengthening the role and potential of the WHO, ensuring its readiness and ability to react in the field of health is important. I can tell you and reassure you that the Belarus health system is doing everything possible as well in these areas, and obviously we support the decisions aimed at improving global health. We support the global initiative of the WHO for health for all and all the systematic efforts of the WHO over the years to react to increasing disease. The health systems inter alia in our country means that we have to ensure that there's access to medical assistance and medicines, and all of these channels to these services and medicines have to remain open. Given the turbulent world we live in, the issue of healthcare is very important. It's clear that there are many challenges at hand, and this really exacerbates the processes, including those of sustainable development. This is why it's so important for us to coordinate all our efforts, both the national, international, and regional levels. Many thanks.
Thank you very much. This was short. Thank you. I now give the word to Colombia. Colombia, the floor is yours.
Thank you very much, Madam Chair. I'm very pleased on behalf of the President, the Vice Minister of Health and the Minister for Health, that we would like to join our voice to others who have commended the Director General, dear Dr. Tedros, who has the full support of our country, and he has the full support for this report that has been very clearly presented in a very comprehensive manner. At the same time, we would like to express our gratitude to the WHO as well as to its Director General to help Colombia regarding the discussion on a reform that establishes and guarantees the fundamental human right to health. They are also helping us with the reforms underway in our country, and we are also sharing experiences and lessons at the regional level. You can count, dear Dr. Tedros, on the commitment of Colombia to work towards a global health architecture. We want to overcome inequalities. We want to make sure that everybody has the right conditions in accessing medical care. There should not be any barriers in accessing One Health for all of our populations. For us, it is fundamental to look at how we can go through this agenda through a perspective of consolidation of peace, since our country is now exiting a conflict that was very long-lasting, and we want to make sure that we establish a sustainable peace in our country. Without peace, there cannot be health. We also want to reinforce this idea of protecting medical staff all over the world. We always want to advance with a multilateral focus. Here, we would like to reiterate our country's will to help with alleviating climate change. This is absolutely essential for healthcare. We want to work on mitigation, and we want to work towards climate justice. It is also important that in the agenda, we look more into this paradigm shift in the fight on drugs. In Latin America, there are many millions of lives that have been lost to this war on drugs. We really need to focus more on health as a human right. There are great challenges ahead, and we count on your leadership as well as the leadership of the WHO to deal with all of these challenges. We are sure that participation will be very robust and active. Thank you.
Thank you, Colombia. I now give the floor to Japan.
Thank you, Madam Chair. I would like to express my sincere gratitude for all of the hard work and the dedication by the Director General, Dr. Tedros, and the WHO Secretariat as we enter the fourth year with COVID-19. Russia's aggression against Ukraine is a clear violation of Ukraine's sovereignty and territorial integrity, a unilateral attempt to change the status quo by force, and as an act that shakes the very foundation of the international order. Japan condemns Russia's attack on healthcare facilities and healthcare workers in Ukraine, and is deeply concerned that Ukraine is facing difficulties in ensuring an adequate healthcare environment. Taking this opportunity, I would like to make a few comments. First, Japan has submitted proposed amendments to international health regulations and comments to the DG's 10 proposal to strengthen global architecture for health emergency preparedness, response, and resilience, HEPA. We would continue our contribution to global health security, especially through the two instruments that WHO has pivotal role on, namely the IHR and the new pandemic instrument. We also look forward to the further development of the HEPA proposals. Second, Japan welcomes the recommendations of the member states of the governance and the financial discipline reform of WHO and compiled the implementation plan by the WHO Secretariat. Japan also welcomes the inclusion of the reforms that Japan attached importance to. We will continue to monitor the Secretariat's progress on the reform closely because we believe that the proposed reform and the increase in asset contributions are interlinked. Third, the COVID-19 pandemic has once again reaffirmed the importance of universal health coverage, both in ordinary time and in time of crisis. In this regard, it is critically vital that all the member states and the partners refocus our attention and resources on the fundamental goal of UHC. As we hold the G7 presidency of this year, Japan will continue to contribute to achieve more resilient, more equitable, and more sustainable UHC, including through the G7 meetings and UN High-level meeting on health in September. To maximize the outcome of these critical opportunities, it is essential to generate synergy among them, including high-level meetings on UHC, PPR, TB, and the SDGs summit. To conclude, I would like to reaffirm our strong commitments to tackle health priorities at the global level and to demonstrate our willingness to work together with WHO and the member states. I thank you, Madam Chair.
Thank you, Japan. I now give the floor to Morocco.
Madame la Présidente.
Dear Madam Chair of the Executive Board, dear Director General of the World Health Organization, dear ladies and gentlemen, members, dear participants, ladies and gentlemen. First of all, the Kingdom of Morocco would like to express its sincere gratitude and thanks to Dr. Tedros for his report, and we would also like to thank his team for their relentless efforts in improving health for all around the world. Now, as part of the different initiatives of the WHO, we would like to particularly welcome the reinforcement of the preparation and response to health emergencies of the WHO. Indeed, the 10 proposals that are stipulated in the draft that aim to reinforce global health architecture, as well as improving resilience, aligns perfectly with the guidelines of the Kingdom of Morocco in healthcare. Emergencies as well as health crises, especially those that are due to COVID-19, have highlighted the need to adopt innovative approaches that are effective to be able to speed up a healthcare system that is resilient and robust. Now, in line with this and aware of this challenge, Morocco committed itself, thanks to the support of our king, to generalize health protection for the entire population in our country. And we have also looked at how we can reform the national healthcare system in depth in Morocco. Dear Mr. President, dear Director General, dear ladies and gentlemen, we believe that it is fundamental that robust healthcare systems that provide universal healthcare to all should be made available. And this will support to the WHO's work in responding to health emergencies. The crisis that has arisen from COVID-19 has shown the important role of the WHO. The WHO has helped many countries to focus their efforts in the health area by focusing on universal healthcare as well as promoting health and the well-being of all. Morocco will continue its tireless work in our cooperation with the WHO to improve monitoring and early detection systems, as well as responding to different health emergencies in line with the provisions of the IHR. We will also work on helping improve the health given to migrants and refugees. Morocco, at the behest of the WHO as well as other partners, is currently working on preparing the third global consultation on the health of migrants and refugees, which will take place in June 2023 in Morocco. Lastly, we would like to commend Madam President, the Director General, as well as the member states of the EB for their commitment in view in reinforcing cooperation and coordination with the WHO, and we wish you the utmost success for the work of this EB. Thank you.
Thank you, Morocco. I give the word now to Timor-Leste.
Honorable President, Director General Dr. Tedros, Regional Directors, Excellencies, distinguished guests, members, ladies and gentlemen. Timor-Leste delegation takes pleasure in presenting compliments from the government and people of Timor-Leste to the 152 session of the Executive Board and extend warm New Year greetings for happier, healthier, safer, and greener times ahead. My delegation commends and applauds Director General for his decisive leadership as he eloquently presented the excellent work of WHO and comprehensive progress over the year. Even as we emerge from the worst effects of the COVID-19 pandemic and the local and global effect on ongoing conflicts, we welcome this opportunity to re-emphasize the centrality of global health as a key enabler of development and progress across the countries. We wholeheartedly support the priorities listed by the Director General, the 5 P's approach: promoting health, providing health, protecting health, powering health, and performing for health. It will not only build health system resilience with a focus on primary care, but also ensure that health security efforts are built on a bedrock of health promotion and prevention. We welcome the move to strengthen WHO's sustainable and flexible financing and hope augmented focused efforts on the health emergency preparedness, climate change, social and behavioral determinants of health. Thank you, DG, for acknowledging Timor-Leste efforts on increasing tobacco tax by 5-fold and introducing tax on sweet and sugary beverage and on alcohol, which is in line with best buys of WHO. I expected, as Share Council members, we commit to make every effort to reduce the burden of non-communicable disease, and with support from WHO, we are working comprehensively on tobacco control through cessation, taxation, and encouraging young people for adopting healthy lifestyles. Without such efforts of all for health, it will be increasingly difficult to achieve health for all. Madam President, let me acknowledge the visionary leadership of Southeast Asia Region Regional Director, Dr. Poonam Katapa Singh, who has truly placed countries at the center of her work by ensuring 75% of the funds are made available at the country level, and this exemplary support is most sincerely appreciated. The 75th Regional Committee for Southeast Asia Region in Paro, Bhutan, which I had the pleasure to attend, highlighted several key priorities, such as endorse the proposal of establishing a regional health emergency council, re-emphasize that there is no health without mental health, and endorse the Paro Declaration on universal access to people-centered mental health care and services, endorse roadmap to prevent and control the increasing burden of NCDs, reiterating the importance of no decision about us without us. The Regional Committee resolved to enhance social participation in its pursuit for public health care and universal health coverage. Welcome the increase in budget for country offices and regional offices as a crucial mechanism to increase impact and at country level. Madam President, regaining the hard-won health achievements.
Madam, unfortunately, I will have to ask you to conclude because we are over 1 minute already.
I thank you very much. Timor-Leste delegation take notes of the progress outlined in these reports with sincere appreciation of continued support and technical assistance from all levels of the WHO. I thank you. Obrigada, para.
Thank you, Timor-Leste. I now give the floor to Canada.
Thank you, Madam Chair. Thank you, Dr. Tedros, for your report and for highlighting points on which we should focus during this Executive Board session. We can all recognize that we have a very busy days ahead of us, and no doubt we came to Geneva with important updates to share, questions about submitted reports, and statements drafted last week in capitals and redrafted on planes or in hotel rooms yesterday. But it is extremely important that we engage in real dialogue, in discussions that will allow us to find solutions to move forward on WHO's 5 priority areas, reach the triple billion goals and the SDGs. A strong WHO is at the core of successfully delivering on agreed goals, and it is a priority for Canada. Over the past year, Member States and the Secretariat have made important progress in strengthening how we can work together to build a WHO that is efficient, effective, accountable and transparent, and more sustainably financed. We will review some of the results of that collaboration during this Executive Board session.
Since the 75th World Health Assembly, the Secretariat and Member States have also made strides towards strengthening the global architecture for health emergency preparedness and response, including meeting of the Intergovernmental Negotiating Body for the new pandemic instrument, launching of negotiations on amendments to the international health regulations, and the first meeting of the Standing Committee on Health Emergency Prevention, Preparedness and Response. While we take these steps, we remain focused on building more accessible and resilient health systems that are equipped to withstand current and future health crises, and we welcome the examples given by the DG. We all must collectively prioritize access to essential services for most vulnerable and marginalized people, including lesbian, gay, bisexual, transgender, queer, intersex, two-spirit, and other gender and sexually diverse people. We recognize the continued strain on WHO's health emergency program, given the proliferation of emergency situations, including COVID-19 pandemic, other outbreaks, environmental disasters, and ongoing international conflicts that have devastating health impacts. With this in mind, we must reiterate that Canada strongly condemns President Putin's unjustifiable and unprovoked invasion of Ukraine. We deplore Russia's attacks on civilians and Ukraine's health services and infrastructure. We stand in solidarity with the people of Ukraine, including health workers who must be protected. Canada remains committed to working with board members, all member states, and the Secretariat to advance global health objectives and look forward to contributing constructively to these important discussions. Thank you, Madam Chair.
Thank you, Canada. Thank you. I give the floor now to UK.
Thank you, Madam Chair. I firstly would like to enormously welcome the Director General's report. It was an extraordinary demonstration of the breadth of WHO's work and the power of science to transform health with the normative function of WHO. I just secondly wanted to say we really strongly support the reforms that you have pushed through, Chair, and that the Secretariat have pushed. We therefore have made our statement online. I'm not going to read it out here. I'm going to just make two comments in addition in response to things people have had, but I would encourage people to read it. That is our formal statement. The first, I can't not note what Colombia said about the importance of war. What we all know, that war is public health in reverse. The very moving things that Director General said on his re-election. And of course, we therefore completely agree with the EU, Japan, the USA, Canada, and others about the appalling situation in Ukraine. And I think as public health people, seeing civilian infrastructure being destroyed in winter, when the effects of that will be mainly on elderly people and children, and seeing health systems attacked is an appalling affront to public health. But the main thing I wanted to just invite the Director General to reflect on was some of the indirect effects of COVID. He mentioned in his excellent speech malaria as an example, but in Europe, for example, we are seeing a significant excess mortality, which is non-COVID related, almost certainly due in part to cardiovascular and other diseases. And I think this fits very much in the framework he gave. But health protection and health improvement, I think, on this one go together. And it is going to take the world several years to recover fully from the indirect effects of COVID. And if the DG was happy to expand a bit on his view about WHO's role in that, I think that would be extremely helpful. Thank you.
Thank you, UK. I think there are several countries who have posted their statements, including my own, Slovenia. We have also posted our statement on the web. And I hope everybody will read it. Thank you, UK, again. And now I give the floor to the Russian Federation.
Many thanks, Madam Chair, Director General, members of the EB. We understand that the great success of your will is in the fight with the pandemic. A key challenge for the post-COVID world is to strengthen the global health architecture. And this means consolidate actions across countries, regional economic associations, and international organizations. We see the WHO as the leading coordinating body in this area. At the same time, we want based on general principles. The politicization of the WHO agenda is unacceptable, and this will simply lead to increased inequality and a deterioration of the situation in developing states. The global health architecture should be based on principles, those of transparency, openness, and equal participation. And this is already underway within the dialogue or the negotiation process for a draft convention, agreement, and other international instruments of the WHO. As we work on this instrument, we must take care to avoid mistakes and avoid haste. We want the tool to be practically oriented and based on action plans. Russia itself is committed to the principle of equal cooperation in global healthcare, and we note with regret that a number of countries have recently been unprepared for constructive dialogue. Let me give you an example. On December 22, the day before there was a technical seminar on substandard and falsified medical products to be held. This was cancelled because of an objection by the Ukrainian delegation to the statement by the Russian expert. This decision was made after consultations with the WHO. Another example, the recent refusal of national collaborating centers in the UK and the United States to provide Russian institutes with reference strains. So the question arises, if we're going to refuse reference influenza strains today for Russia, what are we going to do tomorrow? Refuse to provide vaccines for countries in need or block their production? We also note the concern that the reporting organization on some projects related to the preparedness of countries in emergency situations. We emphasize the importance of providing full accountability to member states of the organization without exception. Many thanks.
Thank you, Rasha. I now give the floor to Afghanistan.
Bismillahir Rahmanir Rahim. Madam President, Dr. Tedros, WHO Director General, honorable ministers, distinguished delegates, ladies and gentlemen. Assalamu alaikum wa rahmatullahi wa barakatuh. At the outset, I thank Dr. Tedros for his historical leadership in the WHO team for their professional commitment and service. You leave a legacy of dedication, perseverance, and love to humanity in the face of crisis. Afghanistan, following the 2 decades-long unprecedented engagement of the global community in spite of many regional and international commitments by our allies to help preserve, protect, promote human and women's rights in particular, access to health care, and at the price of life of tens of thousands of Afghans and our allies today, Afghanistan still remains one of the world's worst humanitarian crises. It experiences the winter with 18.9 million people facing food insecurity and unable to access or afford the food needed to live a healthy life. There are 7 million children and mothers who are malnourished. The climate crisis is compounding existing challenges as Afghanistan is facing its 3rd year of drought. Globally, Afghanistan ranks 170 out of 170 countries for women's inclusion, justice, and security. The health system has lost the best of its human capital and sustains its basic operation with technical and financial support of UN agencies. The de facto authority in Afghanistan, with whom the United States, in agreement with the global community, signed the Doha Agreement, has banned girls' education at secondary and university level, and women are not allowed to work with national and international humanitarian NGOs. In a traditionally conservative society like Afghanistan, banning women from working with humanitarian agencies results in banning women from access to humanitarian aid. Restriction on women's access to education happens in a context where the health system was already suffering from lack of female human resource. The challenge was further exacerbated with recent brain drain and the decision by the Health Ministry of the de facto authority to kick all of high and mid-level managers of technical staff members from the National Health Institution. The ongoing ban on women and girls' education means zero production of female healthcare personnel. When coupled with brain drain, it paves the ground to a disaster that could not be addressed, if it could not be addressed immediately, it will not be compensated with billions of dollars of humanitarian aid. Madam President, the context I presented is very disappointing. There are questions yet to be answered on who to be blamed for what the 40 million people of Afghanistan are suffering from. Should the ongoing trend of blaming only Afghans for all what happened should continue, or it is a time to confess that it was a result of a joint failure, and the responsibility to correct is a joint shared responsibility. In any condition, in the context of post-August 15th crisis, on behalf of my people, I take this opportunity to thank and appreciate the effort and resources provided by donor countries and nations, in the role played by UN agencies and WHO AMRO office at the top for bridging the gap and ensuring the continuity of humanitarian assistance and health service delivery. Madam President, in light of what I presented, there are a few questions to be answered. First, can the ongoing level of health service delivery be sustained in Afghanistan, where women and girls are not allowed to attend schools and universities, resulting in zero production of female health workers? Can national and international NGOs continue effective service delivery, especially for women, while being deprived of the opportunity to recruit female health workers? Can the international community sustain the current level of financial resources for humanitarian assistance in the face of increasing demand and emerging priorities? And what is our joint responsibility toward Afghans beyond the humanitarian assistance, especially for mothers and children? With all that said, while reiterating my message of thanks and appreciation for financial contribution of donor nations, I urge three points.
Sir, please conclude in 15 seconds.
I urge and call on global community. The mysterious withdrawal from Afghanistan compromises our joint values and achievements with the current situation, which is a failure. But Afghans are paying the price alone. If it continues for longer, according to the lessons taught by the history, the repercussions will be costly and disappointing unless we use the available opportunity to correct the course. Afghanistan health system is a relevant example. While it is 2 decades achievements are at risk of collapse during one and a half years old, last years, it has sustained its basic operation.
Afghanistan, you really have to conclude now, and I suggest that you post your very valuable and very important statement on the web. Please do it.
Thank you, and I respect, but for Afghanistan, EB is the only opportunity to raise its voice. I thank you.
That is correct. I understand this, but I think we will all, especially me, read your statement. Please post it. Thank you very much. Standing.
Madam Chair, are you listening? This is the leader of the interpreting team. First of all, congratulations on your election as chair of this board. I wonder if, through you, I could ask the delegates to perhaps slow down just a hair, because the last few speeches were just a bit too quick for us to capture. Thank you.
Yeah, well, this is the danger when we want to say so much and then we speed up to the extent that it's difficult to consume. So I think we should try to comprehend that the key thing here is to send the message to the Secretariat, the guidance, so they can work better with us. But also, as I said, there is a lot there in our national countries to present, and this can be much better read and looked at if it is on the website. And you can spend a lot of time reading it and think of it, and then maybe even include in your statements in some other topics. So now let me go ahead, and I give the floor now to Yemen.
السيد الرئيس، أعضاء المجلس التنفيذي، السلام عليكم ورحمة الله وبركاته. اسمحوا لي في البداية أن أتقدم بجزيل الشكر إلى منظمة.
We'd like to thank the WHO in the person of Dr. Tedros. We'd also like to thank the regional bureaus directed by Dr. Hamid Manzali. We would like to thank you for your support and your assistance to the Republic of Yemen. Without this assistance, we would not have been able to support our health system. Thanks to the funds that we received, our health system now is able to provide adequate health services, and this despite the war that continues in our country and despite the deterioration of the situation there. Although in 2009 we were able to deal with diseases and later the pandemic, we've been able to make progress, and despite that, Yemen has been able to provide a relatively good level of health service. This includes supporting over 50 health institutions. We truly appreciate the WHO's help, and we appreciate their system of responding to pandemics. We support this effort. We support universal health care as well, and the use of their funds and their distribution to the regional offices throughout the world according to the needs of this or that country. Thank you.
Surprised me. I give now the floor to the Syrian Arab Republic.
شكرا السيدة الرئيسة.
Thank you, Madam Chair. Ladies and gentlemen, today, more than at no other epoch, health systems are crucial. They help us to ensure universal health care and help us to implement the Sustainable Development Goals 2030. These objectives of the long term will help countries to arrive in 2030, ensure that no country is left behind by 2030, so that they can deal with poverty. This should also help us help all people throughout the world without exception. Allow me here and now to draw your attention, ladies and gentlemen, to one thing, to the problem of my country and the economic, social, financial, and political issues that are at the crux and the reason of an embargo that has been ongoing for more than 10 years in Syria. This means that many hospitals have had to provide free care to the population, this despite the war. But unfortunately, these hospitals have not been able to get spare parts or tools that they need. So we need your help to stop the embargo, to stop the sanctions. We need to be part of an overall strategy to overcome the challenges we face and to deal with the healthcare issues. At this current time, cholera in Syria is a serious problem. I would like to thank the important role that the WHO plays, and particularly like to thank the Director General for his efforts and his statements, as well as the Regional Bureau, which helps the Minister of Health of my country to face this epidemic. Many countries that have health systems and economic difficulties also are unable to deal with epidemics or diseases, and they are also imposing sanctions and embargo on my country, which prevents us from getting the tools that we need to deal with these issues. In March 2000, there was a speech at the United Nations to address countries so that we were able to get enough tools and spare parts to deal with disease in our country. We want all of the resolutions and declarations to be, multilateral declarations to be put in, to be implemented We want everything that is in the UN Charter to be implemented. We need to take efficient and urgent measures to put an end to all of these negative measures against international law. We want the embargo to stop against the Syrian Arab Republic, and we want the Zionist aggression as well to stop in the occupied territories of the Golan. We hope that all of these challenges will encourage us all to work better together, and we would like to thank all of those who are involved in organizing these meetings. We would like to thank the WHO for always trying to find mechanisms to implement the UN's agenda. Thank you.
Thank you, Syrian Arab Republic. I now give the floor to Denmark. I suppose it's a national statement.
Thank you, Madam Chair. Actually, I have the honor to make this statement on behalf of the group of the 8 Nordic and Baltic countries. And we thank the Director General for his extensive report. In Ukraine, more than 17 million people have fled because of Russia's unprovoked, unjustified and illegal war of aggression. We condemn Russia for violating international law and undermining international security and stability. The 8 Nordic and Baltic countries remain highly committed to supporting the people of Ukraine. Globally, war and conflict have fatal consequences on health, including, but not limited to, direct victims of war, illegal attacks on healthcare facilities and personnel, and disruption of access to health services, including continued treatment of the chronically ill. We welcome and stress the importance of the work of the WHO in emergencies all over the world. During the World Health Assembly in May of last year, the First Lady of Ukraine, Yelena Zelenska, highlighted the mental stress experienced by Ukrainians because of the war. The mental health situation in Ukraine is not unique. We also see this in other regions affected by conflicts and war, where 1 out of 5 people experience depression, anxiety, post-traumatic stress disorder, and other mental disorders. Conflicts and war exacerbate the conditions for persons living in vulnerable situations, in particular women and girls. According to the UNFPA and key partners on the ground, access to livelihood opportunities and essential services in Ukraine, including sexual and reproductive health and rights, have been severely disrupted, with consequences including an increased maternal mortality and morbidity, stillbirths, unmet need for family planning, unintended pregnancies, unsafe abortions, and disabilities. Sexual and gender-based violence is also pervasive, although cases continue to be underreported. We expect the WHO to increase its efforts to meet the current needs of sexual and reproductive health services for the people of Ukraine. While the pandemic has stabilized in many countries, we now face challenges that have worsened during the pandemic. Long waiting lists, shortages of health professionals, with overloaded emergency rooms, wards, and intensive care units. At the same time, we must not forget that many countries are still fighting serious outbreaks of COVID-19. Many people around the world are still not vaccinated. Health systems are once again in response mode, and new variants may emerge. Countries have also faced other emergency outbreaks such as Ebola and Mpox, and we applaud the WHO for its great efforts in responding to these challenges. This situation is a reminder of the great tasks ahead, the need for all countries to strengthen health systems in order to be better prepared for the next pandemic and to achieve universal health coverage. Thank you, Madam Chair.
Thank you, Denmark. I now invite member states that are not represented on the board to give their statements. I start with El Salvador. Salvador, the floor is yours.
Thank you very much, Madam Chair, and thank you very much, Director General, Dr. Tedros. We appreciate all the efforts that have been undertaken by the WHO for El Salvador. And at the same time, we agree with a report that has been prepared by Dr. Tedros, in which we highlight all the work that has been carried out at the country level. And the pandemic has allowed us to draw many different lessons. This has allowed us to help with emerging illnesses such as monkeypox. As PAHO, we were able to take leadership of the extraordinary meeting that was convened by the countries of Latin America. We were also able to quickly manage the response when it came to the monkeypox vaccine, and we were able to get it under control. We're very pleased to see the vision of the WHO, which is in complete alignment with our strategic guidelines. We are trying to achieve our objectives, making sure that we achieve the SDGs and improve our health systems and comply with the main principle of leaving no one behind. Thank you.
Thank you, El Salvador. You also respected the 2 minutes that are given to those member states that are not represented in the EB. Haiti is next on my list. I give the floor to Haiti now.
Merci, Madame la Présidente.
Thank you, Madam Chair. The Asian delegation would like to congratulate the Director General for his 10 proposals in the 12-1 report. These are based on 3 key principles of the WHO Constitution, which means that the possession of the highest standard of health is one of the fundamental rights of every human being, regardless of his race, religion, political opinions, economic or social condition. To do this, we need strong, equitable, resilient national health systems which focus on quality primary health care, and they should have the capacity to detect, prevent, and respond to health emergencies. All this while maintaining essential health services. Madam Chair, equity should be at the center of our thoughts. We have to ensure that no one is left behind. Why? Because equity is also a principle and an objective, and that is to protect the most vulnerable. Here, Haiti is seeking Taiwan's participation in our World Health Assemblies. Haiti recalls that urgency is our collective responsibility. Prior to COVID, Haiti and the majority of countries around the world were unable to meet their commitments. And the pandemic has made the situation worse. Achieving our goals means that we need a recovery plan that is funded. And we need to work on 3 priority areas, in particular, health promotion, preventing disease, getting at the root causes of these diseases. We need primary health care and support for reorientation of health systems towards primary health care as a foundation for universal health coverage. The current crises and emergency situations are a challenge for us, and they mean that we need solidarity-based international cooperation that focus on the priorities and needs of countries receiving aid.
Thank you, Haiti. I give the floor now to Tunisia, and I ask all the member states not represented at the EB that would want to take the floor to please make us know, because I'm going then to close the list before the lunch.
شكرا السيدة الرئيسة. تقدم بداية بخالص.
Thank you, Madam Chair. I would like to begin by thanking Dr. Tedros, the Director General, for his report, which demonstrates all of the efforts made by the organization under his direction, including the reforms underway of the universal health system and strengthening resources. Tunisia accords a great deal of importance to an international agreement on the prevention of pandemics for future generations. Our President, Mr. Kassé Aziz, was one of the leaders and pioneers in this area. He established a legal foundation to allow states to respond to pandemics at the right time. I would like to reaffirm the importance that our country gives to the elaboration of an international instrument via constructive suggestions and inputs. Madam Chair, it's so important for us to amend the international health regulations in a way that's efficient and transparent. This will allow everyone to participate on equal footing as we take into account the financial and human resource limitations of this country. We also call for vaccine, ADN, and other technology transfers. And this was mentioned at the Euro-African Summit, where 6 African countries were singled out to benefit from these technologies. We would like to reassure you of my country's support in the field of health. In the meeting of the Francophone countries mentioned this, and this will allow us to guarantee development in the face of all sorts of challenges, including pandemics. Thank you.
Thank you, Tunisia. I now give the floor to New Zealand.
Madam President, thank you. I am speaking on behalf of Australia and New Zealand. Let me begin by joining Denmark, the United States, Japan, Canada, and the United Kingdom to condemn Russia's illegal and immoral invasion of Ukraine. It is a gross violation of international law, including the Charter of the United Nations prohibition on the use of force. Australia and New Zealand strongly support Ukraine's sovereignty and territorial integrity. We call on Russia to end its war and are working closely with our partners to support Ukraine and hold Russia accountable for its actions. Aside from terrible damage and loss of life, we are particularly concerned by attacks on healthcare facilities, health workers and ambulances. We commend the WHO for its ongoing support to the humanitarian and emergency health response in Ukraine. Australia and New Zealand welcome the Director General's vision for strengthening global health architecture with an effective and empowered WHO at its centre. World Health Organization member states must take lessons learned from the past 3 years to enhance our response to future health threats. Australia and New Zealand will continue to engage closely with the WHO across its 3 levels, with member states and other partners to build a more responsive and agile global health system, including to deliver an effective agreement on pandemic prevention, preparedness and response, and to update the international health regulations. We appreciate WHO's leadership supporting the ongoing global response to COVID-19 and responding to the myriad of other health emergencies. Australia and New Zealand recognise the WHO's many achievements over the past year, and we are pleased to see the focus on priority areas to support countries to deliver on the SDGs. We recognise the challenges posed by the pandemic in achieving WHO's triple billion goals and support the extension of the GPW13. We reiterate the critical role of the WHO's normative work, including developing technical standards and data collection, as well as country-level support to improve health systems. We encourage the WHO to continue to prioritise this wide-ranging work, including technical guidance to address specific health issues in line with best practice approaches and available data. Moving forward, climate change remains the single greatest threat to the livelihood, security and well-being, particularly for Pacific Island countries. We encourage WHO to support countries in building climate-resilient health systems and mainstream a climate perspective in all of its work. Thank you.
Thank you, New Zealand. I now give the floor to Jamaica.
Thank you. Chair, Jamaica would like to thank the DG for his report, and on behalf of my Minister, the Honourable Dr. Christopher Tufton, to congratulate you and your team on the accomplishments stated. Small island developing states share grave health and sustainable development challenges posed by the impacts of natural and man-made hazards, health emergency, economic shocks, and non-communicable diseases. Chair, Jamaica welcomes the time release of the Countdown to 2023 WHO Report on Global Trans Fat Elimination 2022 to decrease the risk of countries losing momentum in moving towards a target of elimination of trans fats. Also, the importance of the inclusion of mental health as a fifth NCD is not lost on us. COVID-19 has turned our attention to a sharper focus on this problem. The integration of mental health in our primary healthcare services and the promotion of mental wellness and reduction of stigma is a priority for us this year. Chair, recognizing that small island developing states are disproportionately impacted and recognizing the continued vulnerabilities of small island developing states, such as ours to external shocks, the COVID-19 pandemic has underlined the importance of strong and resilient health systems underpinned by universal health coverage. With a focus on equitable access, quality and financial protection in the era of COVID-19 and beyond, Jamaica is moving to strengthen its primary healthcare and response systems. We take this opportunity to thank the WHO, PAHO, and all our other partners for the assistance that we received during the heights of the pandemic and continue to receive even now to achieving our vision of a healthy people and a healthy environment. Thank you.
Thank you, Jamaica. I now give the floor to Bangladesh.
Thank you, Madam Chair. We thank the Director General for the comprehensive report. We commend WHO's efforts during this trying time of humanity. Distinguished delegates, COVID-19 pandemic triggered discussion for crafting effective normative measures for WHO. Disease reform initiatives and priorities in this regard deserve our appreciation. A self-contained pandemic instrument with deliverables and effective amendment of IHR 2005 would be exigent for a robust global health architecture. It is alarming that the world is yet in a predicament with the current pandemic situation spanning over the 4th year. While we see the success of science in finding means to respond to the current pandemic, our approach needs to be much more balanced to reap the benefit through ensuring equitable and unhindered access to vaccines, diagnostics, and therapeutics for all. Otherwise, we won't be able to achieve health equities for the people within and among the countries. It is a matter of concern that routine immunization for the children in some parts of the world is on the decline. Hence, it would be important to enhance WHO's effort to those countries to enable them to rejuvenate their routine immunization. As a climate vulnerable country, Bangladesh appreciates WHO's focus on the impact of climate change. Frequency and number of participants of the Young Professionals program should be increased to upskill more young professionals. Bangladesh believes a replenishment process to fill out the gaps in financing would be useful to address its priorities and cater to the need of the people at country level. I thank you, Chair.
Thank you. Thank you, Bangladesh. It's time for lunch now. And on my list, I still have Philippines, Singapore, Thailand, Kenya, Ecuador, and Spain. Let me also inform you that Russian Federation, Denmark, and China have requested a right to reply. In line with our procedures, I will give Russian Federation, Denmark, and China the floor to exercise their right at the end of the meeting today. I also want to remind us all that we will resume in a private meeting after lunch at 14:30. The meeting will be restricted to EB members plus 2 persons per delegations and the member states that are not members of the EB plus 1 person per delegations. Observers will not have access. So by informing you on this, I wish you a good lunch. Please talk to the youth as it was recommended by me and by the Director General. And we'll resume the meeting that I have just mentioned at 14:30. Be back in time because we'll start exactly at 14:30. Thank you.